Welcome. Let me back up here. Welcome to Ask Dr. Geier Live, wherever you're watching. I hope you're making today your masterpiece. It is that time, Friday, 12 p.m. Eastern time, where the one place that I answer your questions. Orthopedics, health, wellness, surgery, rehab, recovery, it is that time. I'm Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. Very excited to be here today. I missed last week. I was out of town speaking at a conference, actually in Napa, California, so not a bad place to get invited to speak. I was really excited about that, had a great time. But I'm very excited to be back here today. As always, please remember, I cannot give medical advice in this show. And if I were to answer email or answer questions other places on social media, YouTube comments, that kind of thing, I still can't give medical advice. That's not allowed online. I'm not your doctor. You're not my patient. But I can answer in a general way meant for general information and education so that you know more about that particular problem. You can talk to your doctor and say, hey, what about this? You can use the information however you want, but it is not me telling you what to do. No doctor can do that unless there's a doctor-patient relationship and they are in your state, at least here in the United States. Also, if you're on YouTube, leave your questions in the chat, not in the comments below. I can't see those. Also, if you're on Twitter, I don't know, I haven't been sending these to Twitter all that often. In case you're wondering, I am not on Twitter. I'm not on YouTube. I'm using a service called Restream to send this out to Twitter and Facebook and YouTube, even though I don't know if it's actually going to Facebook right now or not. But regardless, on Twitter, I don't know if the questions come through or not. A lot of times, because Twitter is, to be fair, one of the few social media services I actually consume content. And so I'll go on and see that people asked questions, and I don't know if that just didn't come through during the live show or if they posted it later, of course, which I wouldn't see it. So if you ask a question on Twitter and I don't see it and I'm not answering it, come on over to my YouTube channel where I know it'll come through. That's where most of these are. All right, let's go ahead and as I always say, I stay for as long as there's questions. I don't just hang around just doing nothing. So if there's 2 questions, then it's quick. If it's 20 questions, then we'll be here a little bit longer. Also, please try to keep your questions short because it's just not fair of me to have people watch me read for 30 seconds. So the shorter the question, the easier it is for me to answer it. All right. Well, if I can get this one on the screen. Peter says, try malalar fracture. One screw's the longest connecting the fibula and tibia. Should you remove it? It's a really interesting question. First of all, in case people are wondering what he's talking about, when you have an ankle fracture, a lot of times, in addition to the bone being broken, the ligaments between the bottom of your tibia and the bottom of your fibula, the bone on the outside of the ankle, get disrupted and the bones can separate apart. If you don't fix that, if you just fix the fibula with plate and screws and you don't basically do something to stabilize that fibula to the tibia while those ligaments heal, you end up with instability, pain, and it just has a poor outcome. In the past, almost everybody did what he's talking about, where you put a screw from the fibula, usually through the plate, through the fibula into the tibia to hold it in place. We've gotten away from that, at least a lot of us have, especially in the sports medicine world, where instead we use a device that's basically suture and buttons so that you can basically hold that in place and then just leave it in forever. There's debate about should you take that screw out. It typically doesn't cause long-term problems, but you give it 3 months, 4 months, it will break without question. As you start walking on it more, and again, not medical advice, this is true with anybody, that screw will eventually break. Then if you decide to take it out, you can really only take out the part that's in the plate. The part that's buried in the tibia will stay there. There's no way to get that out. Now, the argument is that's probably not going to cause any long-term issues. I know there's debate about that. If I was, and again, I don't operate anymore now that I really focus on regenerative orthopedics and anti-aging orthopedics, but if I was still doing these, I would fix it with a plate and screws and then use these basically suture devices, these syndesmosis fixation devices that involve sutures and buttons. Arthrex makes them, and probably other companies make them too, like what you saw with Tua Tagovailoa before the national championship game. That's how I would use it. And then you can just leave it in. You don't have to go in and take it out down the road. Taking it out is another surgery. That's not really something that should be done in the office for infection reasons. And it's just, something that potentially is just more trouble than it's worth. But very interesting question. And like I say, there would be a little bit of debate about that. Morgan, mid-distal humerus fracture almost 2 years ago, delayed union. Surgery wasn't worth the risk of nerve palsy. I can't give you medical advice, whether it's here or any other form, email or anything else, because I'm not your doctor. But typically, most non-unions you fix. I'm a little surprised a patient would be able to, or somebody would be able to do push-ups with a humerus non-union, but again, I'm not there. But generally, the plan usually is to fix those. That's a big surgery, a distal humerus fracture, so maybe that played a role in it, but I can't, again, really say. Full range of motion looks bad. Thoughts on stem cells? I haven't really seen much on stem cells for fracture healing. It's typically used more for soft tissue injuries. I suppose it could help. I suppose PRP could help. There's a number of different biologics that we kind of use to stimulate healing, but usually put in at the time of a fracture fixation surgery. But used in isolation, I don't know that there's much data on that, quite honestly. All right, this is going to be one of those Fridays where we don't have tons of questions. I'll stick around for a couple minutes. If you want to see me as a patient, I see patients in Charleston, South Carolina. No, I don't do phone consults other than just brief conversations to see if it's a treatment potentially I could help. But if you decide to then come work with me after that phone consult, yes, you do have to come to Charleston. But easily 40% of my patients come from all over the country, a couple from other countries to work with me. So I am happy to do that. If you're potentially interested, there's information in the description below, at least if you're watching this on YouTube. It's got a link to my contact page on my website. Go to that, fill out that form, give me a little bit of information about what kind of trouble you're having, and my assistant and I can potentially help set that up. I'd love to help. I help active people, help athletes that just want to get back to what they want to do as well as they want to do it for as long as they want to do it, potentially trying to avoid cortisone, physical therapy, not that physical therapy is bad, but cortisone shots at least, and surgery. So, all right, last one I'm going to do. What's the anti-aging you mentioned? So that's exactly what I was saying. I try to help people avoid surgery, help people avoid cortisone, and get back to what you love to do. And by anti-aging, trying to make the cartilage, the muscle, the tendons and ligaments act and work as if you were younger. And so there's a lot of different ways to do that, a lot of treatments. Unfortunately, what you get in your typical orthopedic surgery practices, and unfortunately what is covered by insurance, doesn't typically do that. If anything, those can speed up the aging process of those structures. So it's a bigger discussion, but that's what I'm getting at. Very, very grateful that you are here. I'm glad I made it. I almost missed today's show because I was stuck behind 2 wrecks on the way here, but very excited I made it. I hope you have a wonderful rest of your weekend, and I look forward to seeing you very, very soon. Take care.